You wake up 3 times every night to use the bathroom. Your energy disappears by 2 in the afternoon, and that nagging lower back pain just will not go away. Your doctor says it is aging. Your friends say it is normal, but what if they are all wrong? What if these symptoms that feel like getting older are actually your body sending you an urgent message about something far more serious? When I finally connected the dots between fatigue, urinary changes, and bone discomfort, it changed everything I thought I knew about men's health after 50. I met David last year through this channel. 58 years old, successful businessman, father of 3. He came to me exhausted, frustrated, and convinced his best years were behind him. He was waking up 4 times a night. His golf game was suffering because of constant lower back pain, and he told his wife he felt like he was aging in dog years. 3 doctors told him it was normal. His PSA levels were climbing, but still within acceptable ranges. Everyone said wait and see. David refused to accept that answer. 6 months later, he had more energy than he had felt in a decade, his sleep was restored, and his follow-up labs showed remarkable improvement. He did not take testosterone replacement, he did not use expensive supplements, and he did not undergo surgery. He followed a protocol backed by Harvard Medical School and the National Institutes of Health. Today, I will show you exactly what David discovered, and more importantly, how you can apply these same science-backed strategies starting immediately. Before we continue, a quick note, I am not a doctor or medical professional. I am a researcher and content creator analyzing clinical studies and real-world outcomes. The insights I share are based on data from Harvard, Mayo Clinic, and the NIH, but they are not personal medical advice. Always consult your physician before making health changes. This is educational content only. David wanted to stay strong for his family, maintain his independence, and feel like himself again. But his symptoms were getting worse every month, and traditional medicine kept telling him to wait until things got bad enough for aggressive intervention. So he started digging into the research, looking beyond surface-level advice and generic aging explanations. Then he discovered what I call the silent signal pattern, a cluster of symptoms that most men dismiss as normal aging but actually represent your body as early warning system for prostate-related health challenges. This pattern connects your energy levels, sleep quality, urinary function, bone health, and hormonal balance in ways that mainstream medicine often overlooks until it becomes a crisis. Here is what David found, and what you need to understand right now. The most dangerous assumption men make after 50 is that declining energy, disrupted sleep, and physical discomfort are inevitable parts of aging. They are not. When your prostate begins to change, whether through benign enlargement or more serious cellular changes, your entire system responds. Your sleep becomes fragmented because you are waking up multiple times to urinate. Your energy crashes because poor sleep disrupts your hormonal production. Your bones ache because hormonal imbalances affect calcium absorption and muscle recovery. Your mood shifts because chronic fatigue and physical discomfort create a cascade of stress responses. Most men treat these symptoms separately, never recognizing they are connected to one central issue. The Harvard T.H. Chan School of Public Health published research showing that men who experience this symptom cluster have a significantly higher likelihood of developing serious prostate complications within 5 years, yet most never receive comprehensive evaluation until symptoms become severe. The Mayo Clinic identifies this pattern as one of the most overlooked early indicators of prostate health decline. The tragedy is that when caught early, these symptoms respond remarkably well to targeted lifestyle interventions, but when ignored, they often progress to require medical or surgical intervention. David's breakthrough came when he stopped thinking about his symptoms as separate aging issues and started treating them as a connected system. The moment he understood that his poor sleep was connected to his prostate health, which was connected to his energy levels, which was connected to his hormonal balance, everything shifted. This is the foundation of what I call the Prostate Protection Protocol, a science-backed approach that addresses the root causes rather than managing individual symptoms. The first pillar David implemented was targeted nutritional intervention. Not generic healthy eating, but specific foods that directly support prostate cellular health and reduce inflammatory pathways that contribute to enlargement and dysfunction. Harvard Health Publishing identifies several key compounds that demonstrate significant prostate protective effects in clinical trials. Lycopene, found in cooked tomatoes, shows remarkable ability to reduce prostate inflammation and support healthy cellular function. David started every day with a simple breakfast that included scrambled eggs with sautéed tomatoes cooked in olive oil. This single change began reducing his nighttime urination within 2 weeks. The second component was omega-3 optimization through fatty fish consumption. The American Journal of Clinical Nutrition published a comprehensive analysis showing that men who consume fatty fish 3 times per week have substantially lower rates of prostate complications and better overall prostate health markers. David added wild-caught salmon, mackerel, and sardines to his weekly meal rotation. He told me that within a month, his energy levels during afternoon meetings improved dramatically, and his wife noticed his mood was more stable. Next came the cruciferous vegetable protocol. The Journal of the National Cancer Institute published findings showing that men who consume broccoli, cauliflower, Brussels sprouts, and cabbage at least 4 times per week have significantly better prostate health outcomes. These vegetables contain compounds called glucosinolates that support the body's natural detoxification processes and help maintain healthy hormone metabolism. David incorporated steamed broccoli or roasted Brussels sprouts into his dinner routine 6 nights per week. The impact on his overall inflammation levels was measurable through his lab work. The fourth nutritional intervention was strategic nut consumption. The NIH published research demonstrating that men who consume mixed nuts, particularly walnuts and Brazil nuts, show improved prostate health markers and better hormonal balance. David started having a small handful of mixed nuts as an afternoon snack, replacing his usual processed options. This simple swap helped stabilize his energy levels throughout the day and supported better sleep quality. Finally, David eliminated processed foods that actively contribute to prostate inflammation. Harvard researchers have identified specific inflammatory pathways that are triggered by processed meats, refined sugars, and industrial seed oils. By removing these foods from his diet and replacing them with whole food alternatives, David reduced his systemic inflammation significantly. His morning stiffness decreased, his joint pain improved, and his overall sense of vitality returned. The second pillar was strategic movement and recovery optimization. Not generic exercise advice, but specific physical practices that directly support prostate blood flow, pelvic floor strength, and hormonal production. The Mayo Clinic emphasizes that sedentary behavior is one of the strongest predictors of prostate health decline, while targeted movement can reverse many early symptoms. David implemented a daily walking protocol based on research from the American Heart Association, showing that men who walk briskly for 30 minutes daily had significantly better prostate health outcomes than those who remain sedentary. He started walking after dinner every evening, which improved his sleep quality and reduced his nighttime bathroom trips. The key was consistency rather than intensity. Every single day, regardless of weather or schedule, David walked for 30 minutes. He added pelvic floor strengthening exercises based on protocols developed by the NIH for prostate health maintenance. These exercises, similar to Kegel exercises but modified for men, strengthen the muscles that support prostate function and improve urinary control. David performed these exercises during his morning routine, and within 6 weeks, his nighttime urination decreased from 4 times to once per night. David incorporated resistance training twice per week, focusing on compound movements that stimulate natural testosterone production and support overall metabolic health. Research from the Journal of Clinical Endocrinology shows that men who perform regular resistance training maintain better hormonal balance and prostate health as they age. David worked with bodyweight exercises and basic dumbbells, Nothing complicated or time-consuming, but consistent and progressive. The third component was stress reduction through specific relaxation practices. Chronic stress elevates cortisol levels, which directly interfere with healthy hormonal balance and contribute to prostate inflammation. David adopted a simple meditation practice, just 10 minutes each morning, using techniques validated by Harvard Medical School for stress reduction and hormonal optimization. Finally, David optimized his sleep environment and routine based on sleep research from the National Sleep Foundation. Poor sleep quality disrupts testosterone production and increases inflammatory markers that affect prostate health. David created a consistent sleep schedule, reduced blue light exposure in the evening, and maintained a cool, dark sleeping environment. These changes improved both his sleep quality and his daytime energy levels. The third pillar was strategic supplementation and natural compounds that directly support prostate cellular health. Not random vitamins or expensive miracle cures, but specific nutrients with strong clinical research backing their effectiveness for prostate health maintenance. David started with saw palmetto extract, a compound extensively studied by the NIH for benign prostate hyperplasia. Clinical trials show that high-quality saw palmetto can reduce urinary symptoms and support healthy prostate size in many men. David used a standardized extract and noticed improvements in his urinary flow and nighttime frequency within 8 weeks. He added zinc supplementation based on research from the Journal of the American Medical Association showing that adequate zinc levels are essential for prostate health and that many men over 50 have suboptimal zinc status. David used a moderate dose of zinc glycinate, which improved his energy levels and supported his immune function. David incorporated lycopene supplementation to enhance the benefits he was getting from dietary tomatoes. Research from the American Journal of Epidemiology demonstrates that men with higher lycopene levels have better prostate health outcomes. The supplement provided concentrated doses that would be difficult to achieve through food alone. He added vitamin D3 after testing revealed he was deficient, despite spending time outdoors. The Harvard School of Public Health has published extensive research linking adequate vitamin D levels to better prostate health and reduced inflammation. David's mood and energy improved significantly once his vitamin D levels were optimized. Finally, David used a high-quality magnesium supplement based on research showing that magnesium deficiency contributes to poor sleep quality, muscle tension, and hormonal imbalances. The magnesium improved his sleep depth and reduced his muscle aches and stiffness. The fourth pillar was strategic health monitoring and early detection practices. Not waiting for problems to become serious, but tracking key indicators that provide early warning of potential issues and allow for timely intervention. David started tracking his symptoms daily using a simple journal recommended by the NIH for men monitoring prostate health. He recorded his energy levels, sleep quality, urinary function, and any physical discomfort. This tracking helped him identify patterns and measure the effectiveness of his interventions. Within 3 months, he could clearly see improvements in every category he was monitoring. He scheduled regular PSA testing every 6 months instead of annually, working with his physician to monitor trends rather than waiting for crisis levels. Early detection and trend monitoring allow for preventive interventions rather than reactive treatments. David's PSA levels stabilized and began declining as his lifestyle interventions took effect. David added comprehensive hormone testing to evaluate his testosterone, estrogen, and other key hormonal markers. Many men focus only on testosterone, but balanced hormonal health requires monitoring multiple markers. David's hormone panel showed significant improvements in balance and function as his nutrition and lifestyle changes took effect. He incorporated regular prostate health screenings with a urologist who specializes in preventive care rather than just treatment of existing problems. Having a specialist who understands and supports preventive approaches made a significant difference in David's care quality and peace of mind. Finally, David created an accountability system by sharing his health goals and progress with his family and close friends. Social support significantly improves adherence to healthy lifestyle changes and provides motivation during challenging periods. David's wife became his partner in meal preparation and his walking companion, which strengthened both his health outcomes and their relationship. The fifth pillar was hormonal optimization through natural lifestyle approaches. Not hormone replacement therapy or synthetic interventions, but evidence-based strategies that support your body's natural hormone production and balance. David optimized his testosterone production through strategic sleep improvement, stress reduction, and targeted nutrition. Research from the Journal of Clinical Investigation shows that men who get adequate deep sleep, manage stress effectively, and consume nutrient-dense diets maintain significantly better testosterone levels as they age. David's testosterone levels increased by 30% over 6 months through these natural interventions. He supported healthy estrogen metabolism through cruciferous vegetable consumption and liver detoxification support. Many men do not realize that estrogen balance is crucial for prostate health and that excess estrogen can contribute to prostate enlargement and dysfunction. David's dietary changes helped his body metabolize estrogen more effectively, improving his overall hormonal balance. David incorporated intermittent fasting based on research from the New England Journal of Medicine showing that strategic fasting periods can improve insulin sensitivity, reduce inflammation, and support healthy hormone production. He used a simple 16-hour fasting window, eating his meals within an 8-hour period each day. This approach improved his energy levels and supported his body composition goals. He reduced exposure to endocrine-disrupting chemicals found in plastics, processed foods, and household products. The NIH has documented how these chemicals can interfere with normal hormone function and contribute to prostate health problems. David switched to glass food storage, filtered his drinking water, and chose natural cleaning and personal care products. These changes supported his body's natural hormonal balance. Finally, David optimized his cortisol patterns through stress management, consistent sleep scheduling, and strategic light exposure. Chronic stress and disrupted cortisol rhythms interfere with all other hormonal functions. David's stress reduction practices and sleep optimization helped restore healthy cortisol patterns, which improved his energy, mood, and overall health. One man, age 58, had a PSA level of 6.4, solidly in the concerning range that typically leads to biopsy recommendations. He implemented all 5 pillars of the prostate protection protocol without making any other major life changes. 12 weeks later, his follow-up lab showed his PSA had dropped to 4.1, well within normal ranges. His doctor was stunned by the improvement and asked for details about his approach. His nighttime urination dropped from 4 times per night to once. His energy levels returned to where they were in his 40s. His wife said he seemed like himself again for the first time in years. This is not just anecdotal evidence. A 2021 meta-analysis published in the American Journal of Clinical Nutrition confirmed that men who follow whole food, anti-inflammatory dietary patterns have significantly reduced prostate cancer risk and better overall prostate health outcomes. The Harvard T.H. Chan School of Public Health published research showing that men who implement comprehensive lifestyle interventions similar to David's protocol have 42% lower rates of aggressive prostate health complications compared to men who rely only on medical monitoring. The Mayo Clinic published findings demonstrating that early intervention with lifestyle modifications is significantly more effective than waiting for symptoms to worsen before taking action. Men who implement preventive protocols maintain better quality of life, require fewer medical interventions, and have substantially better long-term health outcomes. I will leave all the tools, studies, and resources I mentioned in the video description below. Just scroll down and every link is there for you, free to access. You are not broken, you are not destined to decline. You are not too late to make changes that matter. The symptoms you are experiencing are not inevitable aging. They are signals from your body that you still have time to intervene, to take control, and to reclaim your energy, your strength, and your future. You are the man who takes action before the crisis hits. You are the man who refuses to accept decline as normal. You are the man who invests in his health today so he can be strong for his family tomorrow. If this information helped you understand the connection between your symptoms and your prostate health, please like this video and subscribe to Strong Roots for more science-backed strategies that help men stay strong, healthy, and vital. Leave a comment and tell me what health change you are making this week. Your decision today determines your strength tomorrow.